Thank you, Heather. Great. Good morning, everyone. I hope everyone's enjoying this lovely autumn day so far. Just wanted to call the Community Hospice Ombudsman Work Group to order. I would really like to give my co-chair an opportunity, Rep. McCarty, to speak if she's available.
Thank you very much, Representative Dathan. No, I just would like to thank the working group for inviting me to attend today. And I'm very interested naturally in the issue. I know as we move forward, we have a tremendously aging population in our state. And I think it's vital that we look to every area to see what we can do to improve quality of life at the end of life. And I just appreciate very much that you continue to invite me. And I'm not sure, I have a little catching up to do here to see where the group is and what you're going to be talking about. But I did notice you had the right people on this working group. I know I've worked with Mairead Painter in the past, and she's very knowledgeable on so many issues, and particularly on the role of ombudsman. So I think you've got a good group here, and I'm excited to continue to listen and to offer whatever perspective or insight that I may be able to contribute. So thank you very much.
Of course, we are so lucky to have you. You are a true testament to what importance that you bring, because you are so busy. Everybody wants to have you involved with their things because you bring so much great insight and things to the legislature. So really appreciate your involvement, Kathleen. Our other co-chair, Robin Comey, is not in yet. She might jump on in the next couple of minutes, but I'm just going to go ahead and kick it off. I believe, is there anyone new to the group that hasn't been here before? I know we had Katie and Stephen. If you could spend a minute just introducing yourselves to make sure that the group knows who you are, what you're, how you're looking at this group, and how you hope you can add value to the process.
Stephen Magro, I'm the researcher for District 1199, and our members are run the spectrum of workers in long-term care, particularly doing home health care through the Medicaid waivers. And so we have a natural interest in hospice care, and are very much interested in the work of the group. My first meeting. Thank you for having us.
And I'm Katie Traber. I'm the political director for 1199, and I ditto on everything Stephen just said. So yeah.
I realize I keep going on and off mute. Thank you so much for introducing yourselves. I really appreciate it. And it's an important voice to have at the table. I do have a couple of constituents who are also very interested in joining in. Unfortunately haven't been able to be part of the group, but just wanted to give a recap for those that this is their first meeting. We have kind of gone through this kind of process, and we have really identified some sort of key areas that we'll look into. And hopefully everyone had a chance to look at the meeting summary from our September 23rd meeting, where we talked a bit about complaints that we had information on, and really did some data sharing. And Mairead Painter has been a really good asset to talk about the complaint process. She goes through that in the minutes. And then last meeting, we did have a good presentation from Dr. Robinson and her colleague to talk about the complaint process that the Yukon Center on Aging has been doing work on. And so they're continuing to look at additional information. This is kind of part of their agenda. And so we just don't have all of that data yet. And so we have also been looking at trying to get some national data And I know one of our colleagues, Stephen, was going to try to find some of that out. Hopefully we'll get some of that soon. Did anyone have any questions about the minutes or the notes that were sent around last time before we delve into the rest of the issues? Okay. Tracy Wodach, you mentioned that you were going to look into some information, and I know you came back saying that you still haven't received much yet, and what you presented is kind of what you have. Do you have any comments on to the group about some of that information?
Sure. Thank you, Representative Dathan. Hi, everybody. Tracy Wodach from the Connecticut Association for Healthcare at Home. What I did was I contacted the Department of Public Health, Facility Licensing Investigation Department. They are the regulators that license the hospice and home health providers. They do not oversee the non-medical home care, homemaker companion agencies, and they do not regulate the personal care attendance through 1199. So it's strictly the licensed home health and the licensed hospice, small subset based on the larger home and community-based picture. So I asked them for any kind of data on complaints. What happens is, when we admit somebody to services, we are obligated to give the patient family information on who they can contact if they need to discuss any issues. Certainly first we ask them to come right to the agency themselves. And then second, if they feel they need to go beyond the agency, we're required to give the Department of Public Health FLIS phone number. So that's when a complaint would come in to DPH. And I was able to get a breakdown on the numbers that came in for home health versus hospice over the last 3 years. And what we've seen is a decrease in numbers of complaints coming in. And, I'm not sure why. It's a good thing, obviously, to see a decrease. But for home health, we went from 41 in fiscal year 2019 to 34 in 2020 to 25 this past year, with just ended September 30th. And then hospice, we have 20 in 2019, 11 in 2020, and 9 in 2021. Now, these may not be the types of complaints that you are looking at, regarding an ombudsman work group. These are more, maybe a delay in services. They didn't get somebody out there quickly enough. When they do investigate it, it could be they failed to meet a regulation. But I really didn't see any trends in not being heard or not having a voice, or I'm just trying to think of things that would go to an ombudsman. So I mean, I don't really have a lot more information than that. If it's employee conduct or worry about drug diversion, things like that in the past have been items that they've had to look into. But I haven't seen anything trending toward ombudsman piece, and I wouldn't expect to, because
Okay.
really isn't. It's not the avenue.
Right. Okay.
You would go to your social worker in your agency.
Okay. Thank you for that. I saw Rep Comey joined. I'm going to let you jump in before taking some questions on this. Rep Comey, do you want to say hello and introduce yourself to the members of the group that haven't met you yet, and have the opportunity to ask some questions before, or points before we go into questions?
Oh, thank you. Thank you, Representative Dathan. I'm Representative Comey. I see a lot of familiar faces here from our last meeting. I represent Branford, and we have lots of agencies down near us on the shoreline. So I was interested in being a part of this work group. certainly want to make sure that our families in Connecticut have a place to go whenever they're not feeling like their needs are being met, and consumer wise and otherwise. So this is great. I thank you for inviting me to be a part of it. And I don't have any questions at the time. I just have a few thoughts on Tracy's, what she just reported. I jumped in a little late. I'm wondering where did you get that information, Tracy? Where was that information from? I just missed that.
That came directly from the Department of Public Health, Facility Licensing and Investigations.
Okay.
They're the department that oversees the licensures of all healthcare entities.
Okay.
Home health and hospice for this purpose.
For this purpose, right? Yeah. Okay. Thank you.
Great, thank you. I'm going to jump into questions now before we follow up on something else. Diane Lauricelle, welcome to the group this morning.
Good morning, Representative Dathan and all on this fine working group. I do appreciate the work that's gone on. I apologize for not being able to attend the last meeting, but I did read most of the minutes, and I think my thoughts were included. In responding to Tracy's inquiry, and I thank her for doing so, I think we all have to be mindful, as I'm sure we are, that first of all, through my experience and the experience of many people that caused me to reach out to Representative Dathan, they are not aware of the proper method and who to call when there are problems. So we're assuming, we can't, I don't think Tracy is, but we cannot assume that people will feed a complaint into the correct or the agency that would then collect data. So my point is that this data is of some use, but it must be we need at least to know what those complaints were, as Tracy said. I am sure that there are categories that we could get to determine whether the information that Tracy just told us is viable for the discussion to decide whether an ombudsman is needed. Unless we know what those complaints were, I don't think that this information is necessarily, unless we look at the even longer amount of time, we have to be not dependent upon the Department of Health's data. It may, the old garbage in, garbage out I'm not suggesting it's garbage, but I'm not sure that it is reflective of the reality out in the field. I also want to make sure, I'm not sure that patients are aware, or their family members are aware, that if the social worker of the agency is not responsive, then who do they call? And that was mainly the reason for me to advocate for having a home hospice ombudsman, that would be the final pathway. And I have stated before that I'm hoping one thing that comes of this, even if we do not decide to have a home hospice ombudsman, which I think we need, at the very least, we have much clearer flyers in English and Spanish and whatever other languages that clearly state to a patient and their family members, especially, who to call when there is an issue, because that is not clear. So therefore, the data is not reflective of it as far as Department of Health, possibly DSS. I mean, there are a lot of agencies now. That Representative Arconti of Danbury has enacted a complaint hotline, I guess, for seniors. I'm not sure whether that is currently working or if it was his plan to do so. So that may also be something that we need to add to a flyer. So thank you for letting me offer these thoughts.
Okay. Before we start digging into that, I know Mairead had her hand up, and I think she wanted to talk about some of the information that Tracy was talking about. Mairead, please please go ahead. Thank you. And thank
Morning.
you for today. Your voices of wisdom are very appreciated. Thank you.
Thank you. I appreciate that. And thank you, Diane and Tracy, for their comments. I think part of the concern is people do not understand our role and the scope of our role. We are not a post issue. We are not just non-medical. We are not just medical. The role of the Ombudsman's office is to be a conflict-free, autonomous person to represent the residents' right and to provide them with information. And a social worker cannot do that within an agency. They're not conflict-free. They're not autonomous. We've worked with 1199 on other issues and concerns related to, sometimes we're able to intervene in a way and support a person so that they understand maybe why their PCA or their staff person is telling them something. Maybe there is a concern, but we're able to intervene before it rises to the threshold of being potentially a formal complaint. Or maybe the person doesn't want to make that formal complaint because they're afraid of retaliation. When I looked at trying to pull our data, one of the challenges that I have is the way that we identify complaints is by complaint category. We don't target by service, right? So we don't say it was a PCA, it was hospice. If someone is in an assisted living community and they have a non-medical caregiver or hospice and there's a concern, we're there to help them address that concern and be fully informed as to what their rights are, what they can be asking for, how they can be self-advocating. And that's always our goal, that self-advocating. If they can't self-advocate and then they want our assistance, we will continue to provide that assistance. My only sort of sticking point here is that it's hospice centralized. I really believe, and we are still seeing, and this bill nationally is taking more time to come out than I think any of us expected, but around the HCBS language is we are part of a individual's long-term services and supports. And go back 25 years, when rules were put in place about ombudsman programs, it was to support someone regarding their long-term services and supports. And that was primarily in nursing homes at that time. We've seen a shift in that dynamic and really in Connecticut over the past 10 years without a change in the regulation and without funding changes. We did receive sort of oversight of residential care homes and assisted living communities, but we don't have the funding to fully be out there in the way that I wish we were. The new federal funding does say that any program any state that takes the HCBS funding federally must have a community ombudsman program for all LTSS, because under the Older Americans Act, when it was written, it was that we were that conflict-free entity to help people navigate the long-term services and supports arena. And we don't like to be seen as just as a complaint resolver, because that's not a lot of what we do. We do a lot of education, a lot of outreach, and a lot of facilitation of expectations and communication, which, to Tracy's point, can be done by a social worker, can be done by other people, but again, it's not conflict-free. So I think stepping back and seeing us, we are not just a complaint avenue. We are about making sure that people are fully informed, making sure they understand their legislative process, and when things need to be changed, and helping them advocate both at a state and federal level about LTSS.
I think that's a wonderful point, because I think, that is really what I see as the kind of goal of what we need to create in the ombudsman process for, you're looking at it from the long-term care. This group's looking at it from the hospice, and there is overlap, but we also have to understand that sometimes there is an overlap, because if people are doing it at home. And I think that it's a good segue to our pros and cons. Before we get there, I'd really like to hear from Teresa, who's had her hand up and she's been patiently waiting.
Thank you, Representative Dathan. I actually just wanted to respond to Diane's comments. Having been an administrator in home care and hospice for many years, hospice the last 15 alone, we have a process, and just for the good of the group, we have a process as hospices that we are required through the informed consent process to ensure that any patients or families that we are working with understand how to lodge a complaint. And that includes the phone numbers, not only for the agency, but at a higher level for DPH. We do that with every single informed consent meeting that we have. The other piece of that is internally, it's one of our state regulations that we keep a complaint log on every complaint that's lodged. So where DPH may or may not be able to give us a breakdown on the complaints, the local agencies can, because that is tracked. And when DPH comes in to survey us, it's one of the things that they pull right away. And they're looking to match, their complaint with what's in the log. And God forbid that's not there. But I just wanted to make sure that everyone on the call was aware of that. And, and those are things that, we take very seriously as providers.
Thank you. I'm glad to hear that, the providers are definitely thinking about this, and that's important. So thank you. I'm going to jump and ask Jennifer if she has any update on DCP. I know you've been trying to track that down. And if you don't, that's fine. Just wanted to get a quick update and update the group on where we were.
Yes, I actually finally was able to connect with their legislative liaison. So she's actively working on getting some data together with me. So I definitely think by our next group, I'll be able to share some information.
Awesome. Thank you so much for following up. I know sometimes everybody's going in 100 directions. So I appreciate you being the squeaky wheel here.
My pleasure. Thank you.
Yeah. And before we jump into kind of the meat of the meeting today with the discussion of pros and cons, I see Diane has her hand raised again. Diane.
Yes, thank you. I just wanted to clarify. I mean, I'm here representing families and citizens that experience the process of hospice care and home care at home. So while I appreciate the industry folks weighing in, the reason for a home hospice ombudsman is for those providers that either do not follow what is the intent of the industry, or things, they're not conflict-free, as Marie said. So that while the intention is for providers to have complaint logs, it doesn't necessarily mean that it is reflective of what's really going out in the field, because the industry knows that no one is really overseeing whether the information is being given. So I'll just say in my case, it was not clear who to call. And I have numerous friends, as I was trying to figure this out, they said the same thing. Now, again, I don't want to get in the weeds here. I'm sure during the sign off, the initial period, there's a lot of, I know there's discussion, there's papers signed, but I don't really feel that you can assume that every provider conveys information and will report if there's a problem, because they know it'll be on their record that the DPH will maybe take a look at. I know the DPH is understaffed as well. So I just don't want it to be, and I'm sure everyone here knows, nothing is perfect. So that is the reason for a home hospice ombudsman. Thank you.
I think that's a really good segue to talking about the pros. And I'd really like to kind of dig in there a little bit more. We need to be thinking about that. And I think, you highlighted exactly some of the pros why this is an important part of the home hospice offering, is that people really know and are communicated. and it probably needs to happen more than just at the beginning of signing contracts with the helper that comes in. Does anybody want to kind of talk a little bit more about some of the pros that they see, maybe follow on a little bit from what Diane was talking about, so that we can kind of, my goal here is really to be able to present at our next meeting a summary of what we talked about today, and really sort of the pros and the cons. But I'd like to focus for a minute on what Diane has talked about, and how we can do that. And if we do have, alternative thoughts, in terms of maybe why that's not necessary, I'd like to kind of talk about that at this time. I see Tracy has her hand up, and then we can continue to kind of talk about why. Thanks.
Thank you, Representative Dathan. So, I'm thinking through the pros, and my pros end up coming up with some cons at the same time. So I don't know if you want me to go along with that, or do you want me to just?
I think that that's important, because we're kind of talking, I'm looking at it not just on the pros and the cons side, but really this sort of making sure that we have clarity on this role, because I think the one concern that we have is we go down this road, but then there might not be the clarity on the actual positioning, and particularly how we were talking earlier about with Mairead, and how it is, we can make sure that it's separate. So please feel free to attack that solution, or attack the question, both from the pro and the con side, so that we can have a good discussion on that.
Okay, great. Well, I've worked with Mairead before, many years back, but always in the long-term care setting, the nursing home setting. So very familiar with the ombudsman role, and found it very helpful many times. We don't have it in home care, and I'm going to continue, I hope you don't mind, to say home care, because I really don't think singling out hospice is the way to go. This is an issue that's why, and I can see Jennifer shaking her head, because there are so many home and community-based services out there where an ombudsman would be very helpful to have the patient or the family have a voice to be able to be heard and work through issues, et cetera. Again, if the social worker the only social workers, let me clarify, the only social workers that I'm referring to are those that are within the licensed home health and hospice agencies, the regulated licensed agencies. There aren't social workers in homemaker companion agencies. There aren't social workers through 1199 personal care attendants. So I'm a little more narrowed into that licensure, but I'm really trying to look at the big picture, because it is important for those that are getting care in the community to be able to have a voice and to be able to get support and instruction and education and how to process issues. And I don't want to use the term complaint, because it may not be a complaint. It may be a misunderstanding. It may be I don't know what to do. And that, certainly with Diane, it seemed as though, the situation she described at our first meeting, it was a really help me. What do I do? We're trying to work through this, and I need to know who can support me and who can help me understand what the steps are. And that's not a role for DPH. That's not a role for Department of Consumer Protection. And I'm not sure. I mean, maybe it's a role that's somewhat within the care management piece at the access agencies. Jennifer can speak to that. But again, an ombudsman, I think, is that conflict-free opportunity. But I don't want to support it for hospice only. And I also am very worried. I know what the workforce situation is right now. We are really struggling to get staff. So how that would manage on the ombudsman side and their ability to ramp up, if that is the step that we end up taking, I'd be very concerned about their ability to manage the workload, because home and community-based services have just exponentially grown and will continue to do so.
Thank you, Tracy. I think you raised some really strong points there. We are all super concerned about, the workforce, and I'm really glad that 1199 is here to talk about this, because it is an issue. We have a lot of pressure on them, and we all see, as people that care about this industry, how important it is to have the consistency of care, and making sure that folks who are in this space want to, or who want to be in this space, because it is a real career of love and compassion for other people, and we want to make sure that we continue to do that, and how we can do that to support people. So thank you for raising that important point, and I would like to kind of delve into that a little bit more. I do, and I see Marie has her hand up, and I'd love also, Marie, when I call on you, if you could also talk a little bit about what Tracy was referring to. We need to be looking at this role as, instead of a hospice ombudsman, but more of a home care ombudsman that is probably a little bit bigger than just the hospice, because if we do have someone who is having home care, how that's going to be resolved. And I do like the idea of the sort of conflict-free area. So Marie, I'm going to hand it over to you, and would love for you to talk a little bit about this.
Thank you. So this is something we have been looking at for a number of years now. And I just want to Tracy's point about we don't do home care. We actually do home care, because we have oversight in assisted living and residential care homes. So the clients there, 9 times out of 10, are on home care. So that is an area that my team has worked in for years and years now. Especially if they have waiver services in those settings, we work with PCA. So we really already touch all of LTSS. And when I'm talking about LTSS, I'm not just talking about nursing homes. For a long time, that is where people received their long-term services and supports. But now, with a lot of the work that's been done with MFP, we are seeing people, right? They're supposed to have the option to choose the least restrictive environment. And that includes when someone's going on hospice, having the right to return to the community, to be in their own home, to receive those services. And so I really don't see a difference in the education and the services from my team members, also the ability to get team members. What I do think it would require, and what I would like to see come out of this, I think it's an incredibly important role, and that hospice is often an area where people, they don't get all of the education around. I wish there were more people that chose to use hospice as an option, because I think it's an incredible service. But what I will say is I would like to see our program, I kind of see our program growing the way it has in some other states. And again, there's not a lot of information out there. Everybody's kind of waiting to see if the funding comes, what we'll be able to do with it. I would prefer to see in our state, our office as a long-term services and supports ombudsman, because these all fall under that umbrella, and then have a nursing home arm, continue to have the assisted living and residential care home arm, and then a component that does other LTSS services in the community, not just home care, because it encompasses a lot of things. And when we're asking people to self-direct and to plan in a person-centered way, we want to be able to support that family caregiver. We have a lot of individuals that hire family members, and how do we support them and ensure that that they have the education that might be labeled a PCA, right? That's what their title is on the care plan, but they're a family member that is dedicating their time, their services to support their loved one in the setting of their choosing. And we want to make sure that they have all the information they need. So although I love the intention, and Diane, I love that you brought all these points forward, because I think it's an area where there's a gap in LTSS. It's a component of the larger, broader spectrum of long-term services and supports.
So it sounds like to me, we could say that maybe this isn't like a full-time ombudsman, but really a section of what falls under is what I'm kind of hearing from you. Is that sounds about right?
I think I would want to have people who have a specialty, right? So right now I have certain ombudsmen who they all have areas of specialty. I have one who has an area of specialty in memory care issues. And so she goes to the trainings on that. She does a lot of the expert speaking on that. When we have a case where there's challenges, I may kick it to her to help advise. I do believe we should have areas of excellence where people have specialized training, and hospice is such a unique and specialized area. I could see having areas of concentration within the umbrella where, just like now, I know the providers in different areas, as Tracy was saying, because we have those areas of specialty and focus. When you have a memory care issue, the legislature passed to have people have to have specialized training in areas of focus to be able to provide care. I think it makes a lot of sense, to Diane's point, to have a specialized focus and training on the services and expectations and sort of the expertise of hospice, which I think we could get working with the providers. And at a national level, a lot of the end of life group work that's being done. So with, again, under one umbrella, seeing different channels or different pathways where there's areas of expertise, yes.
Got it. That's helpful. Tracy, did you want to maybe kind of respond to that at all as we're talking about this?
Yeah, I think to me it's expansion to include, and I like the idea that Mairead pointed out about specialties. I mean, I would hope that would be how the ombudsman would be trained. Because you're right, hospice is a different type of care, and the supports needed are very different than somebody who is not at the end of life and needing just support in the home.
And sometimes, Tracy, I'm going to guess the issues that come up, right? When it's a delicate period of time.
Mm-hmm.
Things may come up or hit people in a different way and resonate with them that it wouldn't have 5 years before. And so, to your point, it's a very sensitive time in people's lives where you need that consideration.
I see Rep McCarty has tried to raise her hand a couple times. I'm going to let you jump in here.
Yeah. Thank you very much, Representative Dathan. And I apologize, that little icon for the hand raising is missing today, but I really do appreciate the comments Mairead is making. And I just have a request, if possible, that may help us as the working group. If we could maybe create a diagram of some sort and put our branches in there and look at numbers, because I think what we're seeing and hearing today is that we have a need. There is definitely a need, so families can feel comfortable and they know where to go, that we may have to improve a little bit on the education piece and get that information out, as we have done in some other areas. As you know very well, we're looking at suicide prevention. We found new ways to really get information out. So I'm certainly very much in support of finding a way to make sure that all family needs are met, especially during a time that's very difficult for them. So what Mairead is saying, and she knows too, that we've, over the years trying to expand the ombudsman program so that all the needs are met. I think her suggestion to look at an expansion there, since it's already in place, and to see, but I would like to first, if I may, ask for where we think the needs are, and then try to find, build off of that. The next step, we identify the needs and identify the role that the ombudsman would possibly have under that program. And then I don't know if Mairead wants to comment as to whether or not, she knows that we've also looked at what we call volunteer resident advocates that are the first front line. They're working with the individuals, they bring back the information and work with the ombudsman. So whether that could be expanded, we've been struggling over the years to get more and more of these individuals involved. And I know Mairead has done an outstanding job identifying that and working to build that program. But if there's a gap here in services, and it sounds from what I'm hearing that there could be a need, and to have that, an independent type reporting. So I like that suggestion rather than starting, from the very beginning. We have something in place. Let's hope that more of the and Mairead can keep us informed perhaps as where we're going to be with the resources. I think it's crucial. So thank you for the opportunity to make those comments.
Awesome. Thank you, Rep. McCarty. I really, really like the idea of, the diagram. And I do think, Mairead, if you and I and maybe a couple others can think about that in the coming weeks and talk about that for our next meeting, so that we can have a little bit more. I think that is going to be a crucial part of thinking through the legislation for this. Hopefully that works for you. I see a few other folks with their hands up here. Michael, I'm going to call on you next.
Thank you very much, Representative. I really appreciate this conversation that we're having. And just briefly to introduce myself or reintroduce myself to some folks, I'm Michael Warner, and I am the Commission Analyst for focusing on senior issues for the Commission on Women, Children, Seniors, Equity and Opportunity. And in part of that role, I help to administer not only the Long-Term Care Advisory Council, the upcoming statewide Senior Center work group, also the Senior Subcommission, and I was just appointed by Senator Looney to be the co-chair for the Senior Fraud Task Force, which we had our organizational meeting last week. And I want to take a moment to really thank you, Representative Dathan, for your leadership and your championship on this issue of a community ombudsman, because it's very important. And what I want to do is take a step back and just take a look and just kind of go through a short, brief history, which is that the recognition for the need for a community ombudsman, or as I would prefer to call it, a long-term support services ombudsman, okay, is widely known, and it's been going on since before the pandemic. And in fact, in 2019, the legislature passed a law so that the ombudsman would report out on this concept, which she did in January of 2020, right before the pandemic. So this isn't a new need. And the work that we're doing on the Senior Fraud Task Force is to look at the LTSS continuum as a whole, and where are the opportunities for fraud. So, and part of this discussion is going to include not only the opening part, the entry point, as I like to call it, where folks are getting advice on the Medicaid application itself, because as we know, that's a big area of concern, because if folks apply incorrectly or they have the wrong information, they may be told to spend down all of their stuff, and that really impacts kind of the goal and the intention of the legislature, which is always to have not only intergenerational wealth development, sustainability, and as we know, the costs, for example, for not being an institution but aging in place at home is 1/3 of the cost of being institutionalized. So I want to echo everything that Mairead was saying, and also Representative McCarty too. Thank you so much for those comments. But as we look at it as a continuum, the way that the state should look at it, in my opinion, in the work that we're doing, is once the person is a qualified Medicaid or Medicare beneficiary, qualified beneficiary, okay? Once they've been qualified, and by the way, I also want to be mindful to be inclusive of the 18 to 59 population of folks who have disabilities, because it's the same application, it's the same services, then they are equivalent to a large part, I think as much as 40% of those recipients. So we don't want to leave those people behind, and it's not a huge lift to include that. So it's important that we include them. So the state has decided, and by the way, this is something that's it's very important that when we talk about bipartisanship and we talk about the intentions of the legislature and we look at the work of the Aging Committee, near unanimous passage on act concerning senior centers and crime prevention, strengthening Bill of Rights, statewide visitation, the essential support person bill, technology of choice, act strengthening residents family council, and the senior fraud task force. So this was the voice of the legislature. So that's why I want to really refresh ourselves on that topic. And it is with that intention that we want to prevent fraud, okay, in the LTSS community. So what that would then require is to have the ability to access the advice of the long-term care ombudsman. And what really makes that role so critical and vital, and this is just an example of what happens with really good intentions, is when everyone is a mandated reporter, no one is a mandated reporter. It's either 0 or it's 100 miles an hour. And what that does is lead to paralysis. And what we see is that when we talk about senior fraud, when we talk about financial abuse, fraud, exploitation, our commission hosts a training portal. And when we see the training that comes from CPAs who aren't mandated reporters, but they're doing the reporting, and then we have people who are mandated reporters who aren't doing the reporting because they don't have the training. So the need is there. And the concept should be, once someone has been a qualified beneficiary, they need access to an ombudsman. We have similarly situated qualified medical beneficiaries who are disparately treated. Folks in the long-term care facility settings have access to a long-term care ombudsman. Folks who are aging at home, which by the way, the state is promoting Age Well initiative, Age Well collaborative. We're telling mayors, we're telling first selectmen, dementia-friendly neighborhoods. We're doing all of this infrastructure work up on top. That is the will of the legislature. We're trying to attract people from out of state. Come age in Connecticut. We have a lot of great stuff to offer. We need to have the balancing foundation there so that the services that are applied are done so in a way where if there is an opportunity for fraud, that it can be addressed on time. Because what will happen is, and especially with this particularly vulnerable population, when something happens, it's too late. It's too late. What's the remedy? The remedy is the children who are left behind in some cases, and it's too late. So having access and guidance from an office, a long-term support services ombudsman, wherever you are along the continuum, so that they can work to get guidance. Maybe it's not something that requires the chief state's attorney's office or the police. Maybe it's something that can be handled in that way. It can be addressed earlier on, right? Because when we do prevention, then what we'll do is we'll reduce the bad outcomes. So I just wanted to kind of sort of reframe it that way. When we have similarly situated people who are recipients, and we have disparate treatment as far as what they're available to access. And really what we should, the way that our work will be pursuing in the Senior Fraud Task Force is we're going to be looking at the entry point when it comes to the application phase and when it comes to getting the advice, but we are certainly going to be looking at what's going on along the continuum. And so I wanted to just briefly kind of reframe a little bit like that so that we can continue this momentum. I think this is a wonderful area where we can really get true bipartisan and hopefully, once again, near unanimous support. And it will have a fiscal note, but we had a bill with a fiscal note, the bill on senior nursing homes or nursing homes and dementia care residents. So there is a precedent for this, and really what that will do is continue the legislative intent that we're doing, which is to age well in Connecticut, regardless of where you are, and that folks having the choice and the least restrictive setting. And This will allow for the prevention to help reduce fraud, which was one of the main majorly agreed upon pieces of legislation. And it's the work that we're going to be continuing that kind of runs in parallel. And Representative Dathan, just offline afterward, I think I'd like to have a conversation with you about our task force too, so we can kind of see where the overlap is and see if we can bring in some of this good work that you've been doing. Thank you all very much.
I really appreciate those comments, Michael. It's really good. And thank you for the work on the fraud task force. That is such a huge problem. And you're right, we need to make sure that we address aging well in Connecticut. And I really think that that is a good sort of goal of not just this task force, but this working group, but other task forces like what you're working on. We do need to remember that, unfortunately, we do have non-seniors who are needing hospice services, and this is where I see that this task force really is looking after those younger parts of our population as well. Teresa, I'm going to call on you, and I'm also conscious that few folks had to drop off at 11. If you do have to drop off and you want to connect with me later to make sure that we can incorporate all of your thoughts. And as I said, the goal of the next session that we're going to have on the 18th, we'll kind of pull this stuff together and probably think a little bit more about how the structure and how everything is going to work, and really address what you talked about in terms of funding, because that is an important aspect, because we do have some interesting inroads that Marie and I have been speaking about on that. So I'm going to let Teresa, I'm going to let you go ahead and start. And thank you to everyone that has to jump off. I appreciate the discussion.
Thank you, Representative Dathan. Just really briefly, I just wanted to echo Mairead's comments on hospice being a specialty. I think we tend to lose sight of that, and there's definitely need for further support and education there. And to echo Representative McCarty's comments about the need for advocacy, as she highlighted the volunteer advocate concept. I love that idea because, as I think all of you know, the time when families come onto a hospice program or considering a hospice program, it's very emotionally charged. So advocacy is so critical. So that, I think that concept is brilliant and would be a great service to anyone who's working on a hospice program. And not to minimize, again, I think that Tracy's comments regarding this concept of ombudsman for the community being home care and hospice, I think that's very critical, not just the hospice side as well. So thank you all.
Thank you, Teresa. I noticed that Rep. Comey had her hand up and then pulled it down. Do you have any things that you would like to follow up on?
Actually, I think Michael really covered what I was going to, sort of the direction I was going in with the continuity of care within, as we know, the health of folks is fluid, right? We go from one stage to another stage to another stage, and eventually, we leave this earth. But I think that having that same sort of structure and within that same program, ombudsman program, where they know you well, they know your history and your background, and you don't necessarily need to continue to look for services within other programs or agencies or organizations or things like that. So I would like to just echo and Michael's point to the continuity of care within stages of transitioning from stage to stage within healthcare needs. And I've got to run.
Yes, thank you so much.
Good to see everyone.
I appreciate your involvement. Thank you. Marie, I'm going to let you jump in now.
I just wanted to follow up on a few points, and thank you so much. And Michael, thank you. A few of the points that people have been talking about, Representative McCarty, the volunteerism, yes. And you'll be happy to know we have 5 more coming on tomorrow. We've been really ramping up our volunteerism. We really want to see, I would love to see a volunteer in every nursing home, assisted living, and residential care home. Also something we brought up in the recent audit of all of those settings. We think it's a crucial component of a lot of the work that we do, and could see maybe by community, by town, maybe I would love to explore all of those ideas because people really do want to support each other. The knowing people, I think the continuity in that is something that we struggle with at times because we have individuals that choose to receive their long-term services and supports and leave a long-term care setting going into the community. And then they're reaching out to us for assistance because they've developed relationships with the ROs, with our programs, and we don't have the ability to assist them at that time. And that's always challenging. So I think this would further facilitate that. And then on the funding piece that I think Michael brought up as well. So in some states, and to think about this differently, when individuals transition from a nursing home to the community on a waiver, the state does get a match for that, right? It's 50 cents on the dollar. When they do that, they're giving up. They say that they have access to all their long-term services and supports, but we are one of the things that they lose access to. So the state does benefit in the increase in those dollars, but the person doesn't have as many protections. We have often argued that that should be a continuation of the system. And where it would also be a cost savings is that we see that when we intervene early, to Michael's point, and when we help reduce hospitalizations, reduce recidivism because we're able to intervene and to support people, that there's a cost savings to that. It's hard to show because we don't have it in place in order to show that. But I think it makes a big difference, and that's where I would foresee the savings coming, where I actually think it would be a benefit to the state in general in costs under Medicaid for what they're seeing for some people receiving their long-term services and supports in the community. And I also have to run at 11, but I really appreciate this conversation and the dedication to honoring residents' rights and choice and individuals in our greater community. So thank you all so much.
Thank you, Mairead. Always a pleasure to work with you. Thank you. I see Rep McCarthy. I'm going to let you jump in now.
Thank you so much, Representative Dathan. I hate to ask Tracy Wodick to do any more, but she has done such a fabulous job really identifying over the years the cost savings to receiving your care in a home-based setting for seniors that it works for, and wondering if she wouldn't be able to just provide briefly to this working group some of those savings, because I think Mairead just hit on it. We want to look at this in a comprehensive way, look at the need, establish the need, look where the cost savings are, look at all the various streams coming in to see how we can continue to proceed. So Tracy, I'm sorry to ask for that, but I know in the past you have provided us with excellent information, and maybe that could just be updated for the working group. Thank you, Representative Dathan.
Thank you, and excellent points. We really, one of the goals really is to make sure that this is, we see a really good return on our investment here, because we want to have better the outcomes for folks on all sides of this issue, the families, the individuals going through the hospice, as well as the workers and other things. So Tracy, if you could address this, I'd love to hear it.
Sure. So, the Department of Social Services puts out a report every year, and this is all inclusive of home and community-based services. So it would include the Connecticut Home Care Program for Elders, all the waivers receiving the home and community-based services. And for fiscal year 2019, those services saved the state $508.4 million, $508.4 million. And then over the last 14 state fiscal years, $2.5 billion have been saved by transitioning people at home and providing services at home. I will say that the cost savings has been significant in the last 5 years, because we're at $1.7 billion saved. So pretty significant dollars. And thank you, Representative McCarty, for being able to for asking that question, because it comes straight from the Department of Social Services, and we know people want to be at home. That's their choice.
most of the time. That's their choice. And, we want to be able to continue to provide those services, and not just because it's a cost savings vehicle, but because it allows us to care for more people in their environment of choice.
Great points, and also great for the family members. I know when my dad was in a hospice environment, he wasn't able to be at home, and it's an added stress on the family to have to travel to go see them, the inclement weather, and especially we're seeing in a pandemic, the access is not always there. I'm going to call on Dorian Long because she is part of DSS and, sees this information firsthand. I know she's presented some things to the group before. Sorry, Dorian, to put you on the spot here, but would love for you to kind of talk about some of these savings and what we're seeing in terms of how particularly forming this role would ensure that we think about all these things.
Well, thank you. I work in a different division, so I can't speak exactly to the cost savings. But in my experience, our primary program in social work is the protective services for the elderly program. And, what we do find is what Tracy said, is that most of the folks that we serve prefer to be in the community and want the supports there. But we do find circumstances where folks are receiving, services in the home, whether they're privately secured or through our programs, and they do need some support in negotiating that support to ensure that they are truly getting their needs met. The demand for home and community-based services is, going up every year. Absolutely, that is the choice that people want. I do want to put out there that there is definitely a need for some liaison, an ombudsman, someone to liaise with folks so that they understand what the expectations are, what their responsibility is as consumers to protect themselves, to ensure that this works. But absolutely, a shift towards home and community-based services is where, the folks that we're seeing in the protective services program want to be, and the home care program for elders in particular, it's a very big part of that. We basically have them on speed dial in the protective services program. The reason why I was late this morning is I have a weekly call with one of the home care agencies regarding our clients in common and to ensure that they're safe. And when we identify issues that come up, I think the other work that needs to also be done as folks move into hospice care or in other home care supports, if there are other factors that are affecting that individual's receipt of those services, sometimes hospice or other supports can't be provided. So we just need to make sure that we have an infrastructure in place that even with a community ombudsman, if folks aren't able to be well supported, that we have a backup plan and an ability to transition folks, because there's a lot of risk out there for the care providers that are delivering services with these critical needs. So we just want to make sure that folks are, as Mairead said, well trained, but there also needs to be some protections in place to allow services to continue if there's not ideal circumstances. And I do know that we get a lot of concern about folks being able to maintain their ability to do that. So I just want to put that out there. Home and community-based services is the way to go. It's what the folks in Connecticut want. It's a good thing. It's certainly what I want for my family. I have a meeting this afternoon with an architect to work on our house so that my mom can age in place. Right. I hope she doesn't need hospice care. But the truth of the matter is that this is where we're moving as a society. And the reality is that if we can save money and provide quality services, all the better. But we need to make sure that we have protections in place. And certainly we want someone to liaise and educate, but sometimes we're going to need more than that. So as folks move, Connecticut does not have an adult protective services program. So we're talking about older folks, having a program, but folks that are younger than that do not. So just, knowing that we need to make sure that there's an additional safety net besides education and information.
Thank you for that. And I know we talked a lot about that when you did your presentation at, I think it was at the August meeting. Time is a warp for all of us these days, but I think that was it. It was really good. So I appreciate you addressing that. And I do hope, Michael, within your realm of the task force that you're working on, especially when it comes to broad, is dealing with not just the elderly population, but the aging population, as Dorian highlighted. I think that's great. Diane, I see you have your hand up. Would love to kind of hear what you have to say.
Yeah, just briefly, thank you for this discussion. I very much am interested in providing the home care ombudsman. Does make sense, or whatever we want to use as the title, but we have to be mindful that, so it's not just semantics, that people that are in the have a need for hospice is not considered long-term care, even though I think according to Medicare, I'm not sure, 6 months, they have to get sign off from a doctor. So we have to just find a way to craft categories so that the public who might be on a state website can understand that even if it says the Department or Division of Long-Term Care Services, they may say, well, that doesn't include me, I'm on hospice. So that's why I think it's very important to literally spell out the specialties in a way that's very public and available and accessible, both in English, Spanish, and what other language, because everyone here, I'm trying to keep up with all of the acronyms that are thrown around, and I'm getting there, but the public in general may see the phrase long-term care services and not feel that it belongs to them because their family members or they are in hospice. So, but and I also want to say, definitely with all that wonderful money saved that Tracy mentioned, there must be more money placed into this program, with Ms. Long and Tracy and others saying that there's a high demand. The legislature, in a bipartisan way, must recognize, with all that money saved, a lot of that money must go into adding to the Ombudsman program and supporting the companies that do this work, and training and protection. It would be, of course, not a good thing if all that money saved, which is actual money saved for sure, and there's in black and white, I'm sure there's plenty of reports that can back it up as evidence. It has to be, some of it has to be used, and I hope the legislature recognizes it should be pumped into this program. Thank you.
Thank you, Diane. I really do want to delve into the financing on this and funding. It is very, very important. Rep McCarty and I both sit on appropriations, and we are very well ingrained in that. And so I think that's something that we're both focused on. I'm a CPA and finance person by trade, so that's my bread and butter, if you will. So very important. Also, I think we'll be delving more into that in the next meeting, because Braid and I have had some good conversations, especially what's coming down the pike from the feds. And I know we're not quite there yet, but hopefully we can leverage that money, because I would much rather, the federal government financing that than our taxpayers, and we are able to really make sure that we can develop programs to support these things. Tracy, I see you have your hand up, and would love for you to jump in.
Thank you, and I'll try to be quick. Just a couple of things. I wanted to call out Dorian for her citing the reason for being late to the meeting. She had her weekly home meeting with a home care agency. Just for the group's knowledge, the Department of Social Services, Elderly Protective Services Department, which Dorian is very much a lead on, along with Hartford Healthcare at Home, actually won the Innovation Award at our annual conference this Friday.
for the work that they're doing to try to find innovative ways to keep seniors in their homes safely. So just a big shout out there. And then to Diane's point about hospice not really being long-term care, it is defined under long-term care facilities. So it's already there. I agree that we need to make sure that the messaging, if we're to move forward with any type of an ombudsman program, the messaging needs to be clear on how we educate the community of what services are included in the long-term services and supports. So I did want to make sure that that was clear. So thank you.
Thank you, Tracy. I appreciate that. Michael, I'm going to call on you next.
Thank you. I really appreciate this discussion kind of going into the nuance. I would just say this as another refresher. The Ombudsman program comes from federal legislation, the Older Adults Act of 1965, and it's in every single state. And to make things simple, I would view it as they're a qualified beneficiary or they're not, right? So if they're getting the benefits, they should get the long-term support services ombudsman service, which is consistent with the spirit and intention of the original 1965 law. And folks in hospice care, that's how it's getting paid for. So, I certainly agree that, that as far as the specialty in the oversight, if we have, so for example, we look at the long-term care ombudsman program, which has, especially since the pandemic, certainly proven just how vital the office is. When it's got, 8 or 9 total regional ombudsman for the entire state, right? Small but mighty. But what they have is the boots on the ground and the knowledge and the know-how to begin the work to expand. So maybe what we should have is something like the Office of the Chief Ombudsman, right? And then underneath it, we'll have hospice, long-term care facilities, and home-based. So that's one thing. And then just again, we can simplify it first by stepping back and just say, are they a recipient? They are, therefore they qualify, right? Then we can dive down deeper into the minutia of what that sort of difference means as far as like what are the needs of folks in hospice care versus someone who simply needs someone to do some grocery shopping for them, right? And so I just wanted to kind of reframe it a little bit like that, because when we think about where all of this program originates with, right, 1965, it's not something new. It's in every single state. These are folks who are receiving federal dollars, and we can just go from there. Thank you.
Thank you. That's kind of similar to what I've been thinking about based on when we started talking about structure before. And I really like that idea. I'm looking forward to kind of delving into that a little bit more with Maria. And unfortunately, she had to leave early today. Stephen, I'd like to call on you next. I quietly have had your hand raised. Thank you.
Thank you, Representative Datham. So yeah, I'm broadcasting from the in-law unit of my house where my mother lived for the final years of her life at home, and we had a very good experience. And so I'm of course enthusiastic about anything that can help to build supports for long-term care and for hospice. We do, though, represent workers across the spectrum of long-term care. So we tend to think of the long-term care system sort of organically and as an integrated whole, and in a collective and corporate sense. When we naturally, hospice care is incredibly sensitive and very individuated. My mom had it very briefly at the end of her life, and the individual naturally comes to the fore. But we want to caution against over-individuation in our thinking about long-term care, only because when the pandemic hit last year, we had, I think there was a conceptual difficulty for many people on the state and delivery side of home care when it came to, say, delivering PPE. We needed to get PPE to workers and to those individuals receiving care so that they would survive and not get sick. And there was some pushback because of concerns that, well, have the individuals requested it? Will they request it? And eventually we got over that, but it was a conceptual difficulty and a kind of resistance to the kind of collective effort that we needed, and to really seeing the system in its totality and collectively the way that we do at the union. So I just wanted to emphasize that, and that we are, of course, concerned that the safety and health and dignity and respect of workers on the job is a part of this conversation. Because if we don't have healthy and safe workers, healthy and safe workplaces for these workers, then the hospice care is not going to be delivered with the care that it should be. It's just we need to have both pieces of this. We need both wings to fly here. So we're going to be looking very closely at how this impacts workers and how it impacts the people receiving the care. So thank you for this, and
Sure.
thank you for your comments. I very much appreciate again what Michael was saying about the long-term care system and where it's moving.
Great. Yeah, I mean, we do recognize that. And I see Rep. McCarty has her hand up.
Thank you, Representative Dathan. I'm just wondering, and maybe you've already done this with the working group, but as you know, we're still continuing to work on the essential caregiver program within the long-term care facilities, and that will be an ongoing conversation. So I was just curious as to whether this working group had thought about looking national, and I did receive your report. Thank you. I'm going to look through on the palliative care, but I'm wondering, do we have any information from other states that may have been looking at creating an ombudsman for particularly specialized for hospice care or not? If that is something that you had considered or would consider. As you know, we try to learn from other states and see what has happened there and try to build on that if possible. So that's just really a question to you.
Yeah, well, that's an excellent point, Rep. McCarty, and we have been talking about that in an earlier session, and I know Stephen Hernandez has been trying to get some of that information, and we'll continue to follow up with him to see if we can get that information, because I agree, I don't want to recreate the wheel here. I think if we can leverage, other states and their efforts, it is really an important goal in that. But I do think it is important to be able to look at it. I think we've had some great discussion. I'm conscious of time, and I just wanted to kind of, taken some notes here, which we'll pull together for this sort of pros and cons analysis that we'll kind of present a summary next time. But in terms of anything, I think we've talked about some of the worker issues, and I do think we all recognize that the workers that provide the long-term care that is covered under, Maureen's group are well and truly the same people that do provide the hospice care. And there are probably some individuals that are specialized in hospice that might be drawn on. But generally it is the same people, because you want to make sure that you continue the care with the same individuals. I know particularly with memory care issues, to have someone new thrown in at the 11th hour literally is not good for patient outcomes. The other thing that we could do, just in terms of Brett McCarty's point, is requesting an OLR report to see if we can get something for next time. So I'm going to add that to our list of to-dos so that we can make sure of that. But just wanted to check in to see if there's any other further comments. Particularly would love to hear some of the the sort of cons, and it seems like we focused a lot on the pros today. Does anyone have any further comments that they'd like to add in before we close out the meeting for today? Oh, Brett McCarty, you're on mute, Brett. It's the definitive phrase of 2021 is you're muted.
You would think I would know that by now. I just a final comment. I think it's always important when we try any kind of new initiative and looking, and the intent of this is to be helpful and to really meet the needs. So I think it'll be incumbent that we have some sort of statement, mission, what we end up deciding, that we get that out properly so that everyone knows, because it's important that the workers, the agencies, the families, that everyone understands what the intent is. And I think that you go a long way in that regard if everyone's on the same page. So just throwing that out, that's probably a comment for later on, but I think it's important that everyone keep in mind that it isn't to look to say, oh, you're not doing this right, and then people get fear when they put up barriers. We have to present this as something that is being advocated for because we think there's a need and that it's going to be helpful. That's all.
Absolutely. That's something that we kind of set off at the beginning, that we really want to make sure that this is a benefit and not a roadblock. And that was something we need to constantly keep in mind when working on this. We want this to help residents of our state, especially in their final hours, and their families. And that is so important. I definitely want this to be a positive thing, not a negative thing. Diane, I saw you popped up your hand. Would you want to make a comment, please?
Just a quick comment. Again, continuing this discussion and having an ombudsman. And that is that it's kind of a trickle backwards in that in this discussion and the discussion of the process, that state agencies, and there are numerous state agencies, DSS, Department of Health, that are involved in the entire holistic picture, that they will also begin to not only examine their role, but also make sure they have this infrastructure, and will go to the legislature to address the funding need if they need more staff to help kind of enforce or review the licenses, et cetera. So it's in our hope of looking at this, we want to help the industry with training and safety procedures, but also the state agencies that are here, that they will also strengthen their effectiveness and their ability, which they have great ways of letting the public know, letting the industry know, letting the legislators know, and that they have to engage their public relations people in a more creative way once this is discussed and settled. So thank you very much for convening this today.
Great. And I do want to thank everyone for their time. If there's no other comments, I'm going to give everybody a second if they want to raise their hand if they have any final points that they want to talk about for today before we kind of do the administrative things. Looks like we have solved the problems of today. Oh, Brett McCarty, I'll let you. You're on mute again.
I thought it was off.
I know it goes so quickly on and off. So I know with our computers it does that. Thank you.
Thank you. And you may have already done this, so please excuse me, but I'm wondering, would it be possible to just have the names of the working group and their contact information in the event that someone had a question between working group meetings? You may have already done that, and I apologize if you have.
Good reminder. That's great, great reminder. I'm going to ask our administrator, Heather Ferguson Hull, to organize that for us. And that can easily be done. Hopefully she can get something out either later this week or early next week.
I have the spreadsheet. I will send that out to everybody. And if there's any omissions or errors, please let me know, and I'm happy to update that.
Thank you. Thank you.
Yeah, and please, in that, this is, I hate to say, and it's an informal working group, but it's so important that we carry on the dialogue. So I really encourage people to reach out to each other, reach out to me, or anyone, so that we can really carry on this discussion, because I want this to be a thoughtful process, so that when if and when we do talk about legislation around this, that we have done so in a really thoughtful way that is, again, really looking at the improving the outcomes of people in our state. So thank you, everybody, for attending today. We have our next meeting, because usually we're the fourth Thursday, and the fourth Thursday, I hope everyone will be celebrating Thanksgiving with their families. So we won't be meeting that day. So I had scheduled the 18th at 10 a.m. And there is going to be a new Zoom link. So please make sure Heather will send it out to the group closer to the time as a reminder. But we will be having that. And if we need it, I would like everybody to pencil in December 16th at 10 a.m. For a final kind of wrap-up meeting. If we don't feel that we have kind of settled our business on the 18th. And again, because we're not sort of a formal work group, formal task force, the discussions can continue even if we don't necessarily have a group. But I would like to make sure that people have that in their schedules, because December does get busy with holidays and end of the year. So does anybody have any comments? I see Michael's got his hand raised.
Yeah, so I'm just, thank you again for this great conversation. And I think it's completely congruent and in alignment with the work that the legislature's been doing. And so I thank everyone for their shared perspectives. And I think this is really exciting, because again, this is something that's long been recognized, but now we can really take a good look at it as a continuum-wide approach to ensure equal treatment among similarly situated beneficiaries. Regarding the 18th, our Senior Fraud Task Force, because we are mandated to put a report out, we're going to be meeting twice a month on Thursdays in the morning at 10 a.m. So for Anna, hopefully she'll be joining us too on that call. She's one of our task force members. So we're going to be meeting at the same time. I just wanted to mention that. But I think that there's a lot of the work that you have done can certainly complement the work that we're doing. And I think that when we think about this topic and we make sure to say, hey, as a goal, the legislature has said Connecticut wants to address fraud, okay? And there's many different opportunity points for that to occur. And it's a real simple, congruent solution to have a long-term support services ombudsman for all similarly situated qualified beneficiaries. So thank you all, and have a great rest of the weekend.
Great. I'm sorry I won't be able to be there on the 18th, but I would hope that and encourage you, if you can send thoughts between now and then, and we can report to the group at our next formal meeting, some of these things, so that we can make sure that it is on record, that people understand kind of what's happening in the background. And if there are things happening in the background, we do report on these at each of our meetings. So I do appreciate everybody's time today, and thank you in advance for any future thoughts that you have. It is really important that we keep this dialogue going. So if there's nothing else, I would like to conclude the meeting, and hope everyone has a chance to get some fresh air today. It's a beautiful day outside, and makes us all feel so much better when we do that. So thank you again, and I will see you on the 18th. And again, there is a new link that will be coming out. And if I don't hear from you,